Well, let me just start out by saying we don't know how to deal with disinformation. We don't know. I mean, imagine this. We've got vaccines that have gone through the most rigorous clinical trials, double-blind, placebo-controlled trials, the gold standard of testing the effectiveness of a medicine or a vaccine, whatever. The data are compelling. And yet we have data showing in similar studies, and the University of Minnesota was one of the first groups to do this in a very important study, show that ivermectin, this anti-parasitic drug, was not effective and in fact potentially could get to be a toxic kind of situation. And yet we have people today that will not get a vaccination, but they absolutely must have ivermectin. How do you deal with that when, it's just information? And so I think the socialization of information on the internet and the disinformation that's out there today has made a lot of people, they have their own set of facts. And this is something we've never dealt with before. This is very different than vaccine hesitancy. This is really a whole new order of science that I think that we're trying to deal with right now. And many of us don't have answers for what to do about it other than we know it's a real challenge.